Welcome to another segment of Senior Talks, an exciting new educational program for those age 45 and older in the Harris County area. Senior Talks features various presentations on opioid use, medication management, recovery, and overall health. Senior Talks is sponsored by the Harris County Area Agency on Aging and the Wellderly program here through the Council on Recovery. Today we have Rossana Ishee, who's the older adult specialist for the Wellderly program, here to share some information about complications of mixing medication and alcohol. Take it away, Rossana.
Thank you, Latoya. So welcome everyone to another one of our interesting and informative senior talks. Again, I'm Rossana Ishee, and I am the older adult specialist for the Wellderly program at the Council on Recovery. In today's topic, we will cover some of the possible complications that can result when one mixes medications and alcohol. Well, to begin with, older adults can experience a variety of problems from drinking alcohol while taking prescription medications, especially those who take certain medications, have health problems, or drink heavily. This is a recipe for major problems, all of which we will discuss in detail. So to begin with, studies show that adults aged 65 and older make up 12% of the U.S. population, but account for 30% of all prescription use and 30% of all over-the-counter medication use. Furthermore, a national 2008 survey found that about 40% of adults ages 65 and older drink alcohol. And in addition to that, I have some more statistics. 8 out of 10 older adults age 65 take prescribed medicine. 1/3 of older adults take 4 or more prescribed medicines per day. And 40% of older adults drink alcohol with prescription medications. This presents an increased risk for drug interactions as well as mental health disorders. Although the rates of illicit and prescription drug misuse among adults aged 65 and up has increased, alcohol remains the most commonly used substance among the older adult population. Compared to their younger cohorts, older adults are taking more prescribed and over-the-counter medications. This increases the risk for misuse, abuse, and harmful drug interactions. Some of the types of risks include increased blood alcohol levels, increased or decreased drug metabolism, disulfiram-like reactions, and disulfiram is also known as Antibiotics, which is a prescription medication used to treat alcoholism. Disulfiram works by blocking the processing of alcohol in your body, which causes you to have a bad reaction when you drink alcohol. And mixing this medication with alcohol creates a number of side effects ranging from drowsiness, tiredness, headaches, muscle weakness, and can also affect mental and mood changes, just to name a few. Other risks include adverse effects of many medications and interference with the effectiveness of medications. These risks can also present themselves as liver and gastrointestinal disease, sedation, dizziness, problems with coordination, which can also lead to falls and motor vehicle accidents, therapeutic failure or overdose, low or high blood pressure, sleep issues, breast cancer, and worsening of depression, poor control of seizure disorders, and diabetes. Even small amounts of alcohol when mixed with over-the-counter medicines can put one at greater risk. Many medications interact with alcohol, especially those for pain, depression, sleep, and blood thinners. Alcohol depresses the central nervous system, intensifying depression, impairing mental alertness, judgment, memory, and physical coordination. So keep in mind also that some cold medicines and mouthwash might Keep in mind that some cold medicines and mouthwashes may contain alcohol. Just be sure to check the label and steer clear from those products while taking most medications, especially antibiotics. Even though modest alcohol use doesn't reduce the effectiveness of most antibiotics, it can reduce your energy and slow down your recovery from illness. So it's a good idea to avoid alcohol until you finish your antibiotics and you're feeling better. Even overall, adverse drug reactions involve drug effects that are unwanted, unpleasant, toxic, or potentially harmful. All over-the-counter drugs, dietary supplements, and alcohol use should be discussed with a pharmacist or doctor before taking a new prescription. And I would like to take about 2 minutes of your time to show you a clip by the FDA consumer.gov website, and it's about avoiding drug interactions.
This consumer update is brought to you by the U.S. Food and Drug Administration. Combining foods may be a delicious way to enjoy your lunch, but combining drugs with certain foods and beverages, dietary supplements, or other drugs can have unwanted and possibly dangerous side effects.
You should learn about the warnings for any medication you're taking and talk with your doctor about how to lower the risk of interactions.
Drug interaction with food and beverages can include delayed, decreased, or enhanced absorption of medication. For example, if you're taking any sort of medication, health experts recommend that you avoid alcohol altogether, which can increase or decrease the effect of many drugs. Even a supplement as seemingly as innocuous as vitamin E, when taken in combination with certain drugs, can have unintended consequences. Taking it with blood-thinning medications, for instance, may cause an increased risk of bleeding. But among the most serious interactions are drugs with other drugs.
Close to 40% of the U.S. population receives prescriptions for 4 or more medications, and the risk of adverse drug reactions increases dramatically after a patient is on 4 or more medications.
To help avoid drug interactions, be sure to always read drug labels carefully. Learn about the warnings for all the drugs you take, and ask your doctor what you need to avoid when you're prescribed a new medication. Keep medications in their original containers so you can easily identify them. Check with your doctor or pharmacist before taking an over-the-counter drug if you're taking a prescription medication. Use one pharmacy for all your drug needs. Keep all your healthcare professionals informed about everything you take. Keep a list of all medications and supplements, including herbs, that you take, and carry it with you on all medical appointments. For more information on this and other health topics, visit fda.gov/consumer.
So, what we can surmise from the research and self-reported data, mixing alcohol and medications most likely result in major problems, especially for those in mid to later life, 50 years and older. Combining alcohol with non-steroidal anti-inflammatory drugs, for example, ibuprofen, can cause stomach bleeding, gastric inflammation, and liver damage. Also, alcohol increases the sedative effects of medications such as antidepressants, antihistamines, barbiturates, benzodiazepines, muscle relaxants, and opioids, all of which can have serious consequences such as falls, accidents, and even death. So again, we see that mixing alcohol and medications is a recipe for disaster. Some of the key takeaways I'd like to point out are that older adults are vulnerable to adverse effects from the combined effects of alcohol and medications. Some of these interactions are due to normal age-related changes which affect the absorption, distribution, and the way alcohol and medications are metabolized in the body. As our body is affected by the aging process, changes in the way our bodies distribute and metabolize the substances also increase the brain's sensitivity to their effects. As a result, older adults who drink alcohol and take medications put themselves at harm's risk, depending on the amount of alcohol and the type of medications being consumed. Of alcohol-related harm and mortality among older adults clearly shows an urgent need for future interventions to minimize risk. This concludes my presentation on the complications of mixing medications and alcohol. Please stay tuned for our next segment of Senior Talks. And if you have any questions, please, by all means, contact us here at the Council on Recovery. You will find the information on the screen. Thank you so much for tuning in, and I'll see you next time.